Hit the record button. There we go. We are going to get started. It is 11 o'clock. Welcome. Hello. So good to have you with me. I would love it if you would take just a moment and let me know where you're viewing this from. Our group tends to be quite international, and that makes it so much fun. Today, we are going to be talking about pupil indicators. Now, of course, in the few minutes we have, we do not have a lot of time to dive deep here, but we are going to touch the surface and hopefully give you a little bit of insight as to what the pupils can tell us. Just as we are getting ready to launch into this again, welcome. I'd love it if you would take a moment, let me know where you're viewing from. And I'm inviting you to stay with us to the very end of our presentation. Today, I have a special invitation for you. I do. I also encourage you to grab a pen and paper because I'm going to be sharing some of the exact information, some of the exact content that I share in my dynamic iridology course. I do need to do a bit of a disclaimer here that this information is meant for your education only. It is not meant to diagnose or prescribe, and you are responsible for any results you get from using this information. By way of introduction, my name is Judith Cobb. I am a master herbalist, a natural nutrition clinical practitioner, and a level 3 certified iridologist and iridology instructor. I got into the health industry over 4 decades ago when I had some health problems that the doctors couldn't seem to pinpoint or help me with. It was then that I met a young man who knew a little bit about herbs, a little bit about nutrition, a little bit about iridology, a little bit about a lot of things. And I fell in love with him and I loved the things he knew. I took everything he taught me and I ran with it. Since then, with all of the credentials, I have written several books, including The Pregnancy Naturally, The Herbal Birth Kit Handbook, Healthy Kids Naturally, Biokinesiology and Color Therapy Level 1 and 2, and The Confident Nutritionist Dynamic Iridology Textbook. Pretty much every one of those books has a course associated with it. Now, those books are all out of print right now, but I did create and design a level 1 herbology course that was designed to teach people how to use herbs that they were buying in a health food store. A level 2 herbology, which was teaching my students how to understand the ingredients that are in a formulation and could use that formulation for more than what the label said. The answer is usually yes. Also with biokinesiology and color therapy level 1 and 2, I taught courses in that. For a few years, I was a certified prenatal educator, and so I designed and taught prenatal classes, and I still love working with fertility and with my pregnant clients and with my new parents. I also designed the Dynamic Iridology Assessment System, which is, if you're familiar with the International Iridology Practitioners Association, my Dynamic Iridology course encompasses all of the level 1 and level 2 curriculum that is required to apply for certification, to sit for the certification exam. Stay with me till the very end of today's workshop because I will share just a few minutes worth of information about the Dynamic Iridology System course that is starting in April, starting April 21st, a week from today. Also, just to note here that I am one of only 3 level 3 certified instructors in the world. And so there we have that. I am a member of the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutritional Professionals. I'm also a professional member of the Alberta Herbalist Association. All right, we've got Maria joining us from the Philippines. Hello, Maria. It is always good to have you with us on the webinar. Thanks for being there. Are you ready to look at some eyeballs now? Now, I'm going to tell you, the more you play with me in my sandbox, the more you comment, the more questions you ask, the more you're going to get out of me today, right? And so if you want more, then interact with me and I will give you more. So as we look at iridology, we obviously look at the iris, which is the colored part of the eye. We look at the sclera, which is the white part of the eye. And we also look at the edge of the pupil. Each of these different parts of the eye gives us different information. For instance, the iris teaches us about the person's inherent predispositions. What are the strengths and weaknesses they have inherited from the last 3 or 4 generations? The iris also gives us information about personality traits and personality tendencies. The sclera tells us what the person is doing with their body, where there might be areas that are really stressing, and sometimes it even gives us some clues as to what kinds of stress the body is under right now. Looking at the pupil specifically gives us information about the spinal column and about the nervous system. So for example, when we see eyes where the pupils are small, this is called miosis. This is an ophthalmological term. Now, what we need to remember is that we can never assess miosis from a photograph, right? Because with this photograph, we have a lot of light going in. The pupil responds very quickly to light. And so even with this very quick flash, those pupils are going to spasm shut, right? They're going to shut down. So even though we're looking at photos that were taken with a camera, we would never actually assess miosis from photographs. We always want to assess miosis in a face-to-face situation. Miosis, or that very small pupil, is a parasympathetic nervous system response, right? When we see miosis, we know that this is a person who likes to be in control. They like their whole world to be calm, and that is a parasympathetic place to be. So when we see someone whose pupils are very small, we know that they actually want to be calm. We know that their parasympathetic system is probably working hard to keep them calm. Here's another good example of miosis. Now, for those of you who are with me on Instagram, I'm going to move my camera closer, try to cut out some of the room reflections we've got going on for you. You can see how small these pupils are. Also, again, these are photographs with bright flash. That will be part of what made the pupil small. So when we look at these pupils, we always want room lighting. And we want to, if we can, we want to compare their pupil size to other people in the room to see, with the lighting, are all the pupils in the room small, or is it just this person? Then we have the situation called mydriasis. Now, you can assess mydriasis in a photograph. Mydriasis is large pupils. So we see how large this is. An enlarged pupil is very common in children. This is a sympathetic nervous system response. So this means this person is always ready for the next crisis. They're always on edge. They're ready for the fight or flight to kick in very quickly. And so when we see these large pupils, again, we know that they tend to be on the high alert. If someone has large pupils in normal lighting and you're taking a photograph, you will need to use a very fast shutter speed, and you will need to underexpose the photos, right? Otherwise, the light is going to feel too bright for them. Their pupils are wide open to allow more light. If you're doing a photograph of their eyes and you don't turn down your light power in your camera, it's really going to hurt. They're not going to be happy with you. It's not going to do damage, but they will be physically uncomfortable. People with large pupils tend to be very generous. They tend to be, and again, they tend to run in the sympathetic nervous system. It's important to remember that your pupil size can also be a reflection of they're looking at something beautiful or they're looking at someone they love. When pupils are large, we can be looking at something that we really enjoy. When pupils are small, it can also be affected by us looking at something that we don't want to be seeing. Question in Facebook, what is the white line that can be seen in the iris? So I'm not sure exactly which line you're referring to. Chelsea, are you referring to this line coming around here? Or are you referring to this line right here? So was it A or is it B? And I know there's about a 15-second delay for Facebook. So yes, B. Okay, so B is a reflection from the photographic equipment. It's not an actual iris marking. It's an artifact. Good question, though. Very observant of you. These pupils are slightly mydriatic. They weren't as large as the ones we just saw. This person is still always on the high alert, always ready to respond to the next crisis. This person is prepped. They're prepped for fight, flight, or freeze. An ellipse. So sometimes, no, let me rephrase that. There are very rarely cases where pupils are actually round. And so you can see that this one is slightly elliptical and its axis is running this way. Heel-wise solutions, would those be elliptical? So heel-wise, were you referring to the previous image? I believe that we were looking at, so whoops, I did not mean to do that, just a moment. Were you referring to these images? This is flattened as opposed to elliptical because this side is still round. And so this one again has flattenings, but not elliptical. So here, this is elliptical. This can suggest an impending risk of paralysis. Okay, now you need to remember that it's very specific about the direction of the ellipse and which eye it is in. So this one specifically shows a risk of paralysis. It doesn't mean there is absolutely going to be paralysis. It means there is increased risk for this person in particular. Amongst other things, we can sometimes see with an ellipse, again, depending on what direction it's going, it can suggest an increased risk of impending stroke. It can be an increased risk of asthma, particularly nervous asthma. It can be an impending risk on heart situations or thyroid situations. So we have to know what direction the ellipse is pointing in order to know exactly how to assess it. The shape of the pupil is dynamic. And so because the shape changes with situations, and as does the sclera, we can monitor things. So Chesley is saying you base that on the flatness of the pupil, on the fact that it has an elongated feeling going this way. So it's not just the flatness, it's what is the overall feel, because a pupil can have a flattening anywhere, and that does not always make it into an ellipse. Here we have another ellipse. Again, as we look at it, the axis is running this way. So this is a client's left eye. That means this is pointing up to the right. We would describe this as being a right divergent or a right superior divergent, meaning the top of this ellipse is pointing away from the midline. So again, we would need to assess what direction this is pointing and what risks does that increase. Now, again, it's not a guarantee of an absolute impending doom. When we see an ellipse, we always want to ask questions. We want to find out if the client has any particular symptoms that correlate with what we are seeing. Do they have any other iris or sclera markings that, again, support the increased risk? And we want to be asking questions. Of course, we want to ask those questions very carefully, because the last thing we want to do, no, let me rephrase that, the thing we absolutely do not want to do is to instill fear. We always want to empower our clients. Here's another really good example of an iris that's not round. This one has flattenings. There's a flattening here and a flattening here. So when we are assessing flattenings, the first thing we want to do is look at what is the adjacent organ reaction field, because that is the first area of impact for this flattening. And then we want to look opposite, what is the opposite organ reaction field? Because that is going to be the second area of impact. Here's a primary area of flattening. So our attached organ reaction field is here. And our opposite organ reaction field is here. So again, depending on whether this is a right eye or a left eye, and in this case, it's a right eye, we would assess the adjacent and opposite using our iris map for the right eye. This one particularly is suggesting some pituitary involvement and some kidney adrenal involvement, as well as some bladder involvement and some lung involvement in the upper lung area here. Interestingly, this client has asthma. When you know your anatomy and physiology, what you understand is that asthma is a lung symptom due to acid imbalance. Acid is controlled by the kidneys. Does that make sense? If that makes sense, give me a 1. Give me a 1. Excellent. Thank you, Maria. I appreciate that that is making sense for you. And Healthwise Solutions, fabulous. Thank you. And Healer on a Mission, thank you. I appreciate that. And Chesley, wonderful. Here we have some more flattenings. In this case, we've got a lower lateral flattening and a lower or an inferior lateral and an inferior medial flattening. Can I say that last sentence back, please? So I'm assuming, actually, rather than that, let me do this one and we will see if it covers it, okay? So here we have an inferior medial and an inferior lateral flattening. And so as we look at this, again, this is our inferior lateral. This is our inferior medial. Inferior lateral, the adjacent organ is ovary. I'm not even going to do the opposite because of this client's case. The inferior medial, the adjacent organs are pancreas and liver. This client presented with polycystic ovarian syndrome, which affects the ovary and is tied to syndrome X, which includes insulin resistance and liver difficulties balancing hormones. Okay, and so her flattenings made complete and total sense. Now, we don't obviously have time to go into all the therapies that we used with these people. We are just simply looking at the eyes. You can see as we're doing this why it is so important that you have a solid foundation in anatomy and physiology. You simply cannot do iridology at this level if you don't understand how the organs work and how they work together. It is absolutely critical. So many people think, I just have to recognize a marking and that it's in a specific place on the map. That is so not true. That is so simplistic and so limiting. You have to know how the organs work and how they work together in order to really do a valid and deep iris assessment. In this particular client, what we see is we have, this is her right eye and this is her left eye. We have a superior lateral flattening, which is spanning a pancreas area for the adjacent. In the left eye, we have a superior medial flattening and an inferior medial flattening, both of which are spanning other pancreatic points. Interesting with this client, she presented, she's actually a lifelong client of mine. She's been a client of mine for four decades now. And when she came to me about 3 years ago, again, clients come for a few years, or for a few appointments, they get on track, they go off for a few years, and when things start to fall apart as they get older, they come back. And so she's boomeranged back many times. The most recent time when she came to me, she came with lab tests that said she had elevated A1C, elevated triglycerides, and elevated cholesterol. Okay, so when you understand how those imbalances are created from diet perspectives and from organ imbalance perspectives, you'll understand then the importance of the fact that she has specific liver pigments in her eyes. I'm going to move my camera closer again. So she's got specific liver pigments in her eyes. These teach us that the liver doesn't want to do its job. And those of you who are mapping this, you're going, but those aren't in liver zones, especially this one. You're absolutely right. This is why you have to understand the color of the pigment and the placement of the pigment as well. So we know that her liver doesn't want to do its job. She has a lipemic diathesis, which says her liver doesn't want to process carbs properly. That can certainly lead to elevated triglycerides and elevated cholesterol. So we started working with her, and again, like for the umpteenth time, and I love it when my clients boomerang back like that. We did some really focused diet work and some focused supplement work. We were able to get all her numbers balanced, get her into the healthy zones again, got her to lose 10 pounds. She had about 20 more pounds to go. Then when life kind of fell apart for her and the stress got to be so much that it unbalanced everything we did, she fell out of the healthy habits that we had outlined and that she was being so successful with. She was off the bandwagon, so to speak, for a while, and then she had a heart attack. Right? Could we see that she had a heart attack pending? No, we could not. We did not see any specific indicator here that her blood vessels in her heart were going to congest and cause a problem. We see some global indicators though, possibly with the lipemic diathesis. We know there's an increased risk of heart attack when we have insulin resistance and elevated triglycerides. Fortunately, she survived, and she's about 18 months post heart attack now, doing very well, and we are getting her back on her program. The doctors really put a lot of fear into people who have had a heart attack, and so it's taken her a while to decide she wanted to get back on the holistic bandwagon. But she's back. She's back. All right, so there we have flattenings again that teach us much about the client. And again, in seeing where the flattenings were for this client and seeing all the other markings that correlate and give me more information. And understanding that her hemoglobin A1C was elevated and her triglycerides and cholesterol were also elevated. It told me that exactly what we needed to do and what questions I needed to ask her. It also suggested to me specifically that she probably has elevated homocysteine, and she did not bring a lab test in for that, but I decided to include that in my program for her to do things that would bring her homocysteine back down into a better range. All right, did all of that make sense for you? If it did, give me a 2. If it did, give me a 2 in the comments. Again, we don't have time to go into all of the therapies and protocols that I used with each of these people. We are simply learning markings. Chesley, thank you. That's great. And Maria, wonderful. Thank you. And health-wise, fabulous. All right. So some health professionals want to learn iridology just because they do, and that is absolutely fabulous. And after they learn it, they find that it helps them in so many other ways, which is wonderful. It helps them to do their client assessments more quickly. It helps them to be more accurate in their assessments. It helps them to develop better and faster rapport with their clients. And eliminates the need for an intake form. Now, you still want to have your release form, your informed consent form, whatever you want to call the form the clients sign that said where they say they recognize you're not a medical doctor and you're not going to diagnose and prescribe. But I never give my clients an extensive questionnaire because the eyes and my client's symptoms tell me what questions to ask my client. The dynamic iridology assessment system is for health professionals. It is the only live, online, fully mentored course for nutritionists, herbalists, and naturopaths who want to streamline their clinical work without sacrificing client care. Now, how do I define health professional? I define that very loosely as anyone who has completed a college-level anatomy and physiology course. You heard earlier on in the presentation how important it is to know anatomy and physiology. It is absolutely critical. We are not learning a paint by numbers process for doing iridology. We are learning how to do an assessment. This is so important. Learning iridology will help you stop working overtime creating your client programs. It will help you to create programs that don't overwhelm your clients. And it will help you to create programs that will increase your client compliance and retention. I mean, I mentioned a client there that I've had for 4 decades, right? And so this is a good thing. We want clients who want to keep coming back over the years as their bodies change. This is Michelle Davies. She's a graduate of my class, and she came to me well-trained, already having taken other iridology courses. She said she took my course because she wanted the latest information from an experienced practitioner that has used iridology in nutritional practice for a long time. Having my classroom at home allowed me to have all my charts and books by my side, made it easier, and having an awesome sharing and caring teacher made it the best. Judith helped me better my nutritional iridology practice. I recommend her course to everyone. Love it. Love it. This is a note from a recent grad. This is from Dawn. She is also a nutritional coach. She's graduated from the Canadian School of Natural Nutrition. She said, I would like to thank you so much for all you've done to help me on my iridology journey. I appreciate your teaching skills, your follow-up, your availability, and all the time you spend presenting and marking. There is a lot of marking that I do with this. I am truly blessed to have you in my life. Lovely, lovely. I love my students. We just formed such a rapport. Karen Choate, who is graduated from my course probably 4 years ago, also a CNHP, specializes in gut health, said this: I just returned from a regenerative detoxification course where iridology is implemented. I spread the word about what a wonderful teacher you are. Most people I talked with did not have anywhere near the same experience with their iridology education. They had no support, they have unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported, even still, as I have graduated almost 4 years ago now. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Thank you from the bottom of my heart. I'm eternally grateful for your never-ending patience and support. We will touch on that never-ending patience and support in just a moment, like right here. What's included in the course? You get 20 2.25-hour live webinar classes. Yes, if you've been with me for a while, you'll recognize that classes are now 15 minutes longer, because I'm finding I've got so much more that I want to add that I had to lengthen the program a little bit. We meet for class once each week. You have 2 extra 1-hour live webinar mentoring sessions per month. These are optional. You don't have to attend them, but these are for you to get more of your questions answered that you maybe thought of after the class or didn't ask during class for some reason. It's a place for you to present cases you're working on so we can discuss them and help you think them through. It's a place for us to talk about business building principles, right? Success and how to have a good business. The course includes 225 plus page illustrated, full color digital downloadable textbook. I keep it digital because I like to keep my book totally up to date with the curriculum, and periodically I will go through it and I'll go, well, you know what, that makes sense, but I think it could be clearer, and I will edit the book. If I had done these as hard copy books, charging $250 or $300 a piece, like most iridology instructors do, then that would mean that eventually you would need to buy a new textbook. But my students, past and present, all receive access to the latest version of the textbook, no matter when they took the course, right? It's a beautiful way for me to do ongoing support. We also have 45 pages of cheat sheets or study notes, however you'd like to refer to these. These are designed for quick reference while you're with a client. You receive recordings of each of your class sessions and the mentoring sessions. You've got access to all of that on the student site. Class sizes are small. I take no more than 10 students per class. And when we hit 10, we start a wait list for the next start date. We also include one-on-one mentoring for certification preparation. And that amounts to quite a few hours of my time dedicated to you individually to enhance your chance of becoming certified on your first attempt. That is always my goal, is that you will certify with the International Iridology Practitioners Association the first time you take their test. So if this course sounds like something you want, I invite you to book a call with me, and you can see the link on your screen, tinyurl.com/insight-call. The next course is starting on April 21st. And you can see what time of day the course will be happening in your time zone if you're in North America. Registration closes on the 19th. So it closes on Tuesday. If you are interested in this course and in joining us for the April 21st start date, I encourage you to hop on that URL and schedule a time for a Zoom call with me. If you are a holistic, or if you are a health professional, if you actually have the anatomy and physiology on your belt, under your belt, I especially want to speak with you. If you don't have that under your belt, please send me a message and I will link you up with the Canadian School of Natural Nutrition and their anatomy and physiology course so that you can do that course by distance learning and get it under your belt and be ready to start dynamic iridology probably by the end of summer, right? So really important, so important that you have A&P under your belt before you come to iridology. My experience has been that students who don't have the A and P get lost and drop out by the halfway point. I don't want that to happen to you. I want you to be wildly successful with iridology, right? So there we have it. An introduction to some pupil indicators and an invitation to book a Zoom call to discuss the dynamic iridology assessment program to see if it's a good fit for you. I look forward to speaking with you soon. Have a fabulous day. Bye for now.